Hi everybody, welcome to Healthline. I am Gregory Zarian. How is your fall going? Did you get your flu shot? Are you taking care of yourself? As we always invite you to do here is, are you staying active? When spring is around, we tend to drop weight and try to get our fitness on. Now that we're going into fall, we sometimes kind of walk away from all of that. So we invite you to stay active. We invite you to go outside. We invite you to put your phones down, turn off the computer and the TV, and be outside and be active. So, and also, if you're not feeling good, wear socks and throw on a scarf. And 8 to 10 glasses of water a day will keep you hydrated. So, the conversation today is all about you lovely ladies. It's about cervical cancer and what you need to know and what you need to not know in regards to how to have proper cervical health. Joining us from Adventist Health Glendale, to my right is Dr. Pak, and right next to her is Dr. Natalie Nguyen, both OB/GYN doctors. Hi doctors, how are you?
Hello, we're doing really well.
Welcome to Healthline, your first time here.
Yes, thank you.
So glad to have you.
Thank you.
Out of the gate, what got you involved in your specialty? Dr. Pak?
Well, for me, I always wanted to kind of be involved in women's health, just being a female myself, and growing up like in Asian culture, it was my way to kind of give back to women and help the community.
Thank you. And when you say in regards to Asian culture, what does that mean?
Well, I think for Asian culture, a lot of things can be taboo, or a lot of, times it's hard to talk to your family or your parents about different things that we deal with as women. So I kind of wanted to be an integral role for other women, especially, young women as they get older. And that's the thing about OB/GYN is you take care of women through all parts of their life.
Have the conversation about it.
Yeah, exactly.
But I love that. Dr. Nguyen?
So OB/GYN actually caught me by surprise. I went to medical school thinking I was going to become a neurologist, actually. And my first rotation of third year ended up being OB/GYN, and by the end of the second week, I realized that that's what I wanted to do. I was a student coming in early. I was always the last one to leave, and I just loved that you could have that continuity of care with patients and still do surgery. I knew I wanted to do something with my hands, so it seemed the best of both worlds. So that's why I picked OB. And just to make sure, I did some neuro rotations, and it just was not for me.
Well, I love that. But what I love, though, is that you save lives every day. And what I find inspiring is that you're women talking to women about what women need to know, especially stepping outside of your culture. Some of my culture, Armenian German, a lot of it is what you don't talk about. So the reason why this show is so important to me is to pass on what we need to know about our health, about our wellness, and especially being a man. Men don't talk about it. Okay, ladies, call your friends, get pen and paper, because when we come back, we're going to share with you all you need to know about HPV and cervical cancer, signs and symptoms, and what you need to know. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Once again, U.S. News and World Report names Adventist Health Glendale among best hospitals, ranking number 16 in the Los Angeles metro area, number 28 in all of California, and high performing in 5 categories of care. Our mission here at Healthline is to give you all you need to know about health and wellness. Find the hospital that is closest to you and find out what their specialty is. The conversation today is all about cervical cancer, HPV, and women's health. Joining us, OB/GYN super pros from Adventist Health Glendale. To my right, Dr. Pak, and right next to her, Dr. Natalie Nguyen. Once again, doctors, thank you for being here. What is cervical cancer? Let's just dive into that and ask what that is.
So why should we talk about cervical cancer? Why is it important? It's actually the 3rd most common GYN cancer in the United States. And there are different stages of abnormal cells before it can actually lead to cervical cancer. Dysplasia, or CIN, which is cervical intraepithelial neoplasia. There's 1 and 3, 1 being the low risk, 3 the highest risk or higher risk. Eventually, if those cells are not monitored, it can eventually lead to invasive cervical cancer, which is growth that's just out of control.
Some of the statistics that I came across that we were talking about in regards to just numbers, close to 14,000 new cases a year in the United States, and over 4,200 women will die a year from cervical cancer. What are some of the signs and symptoms of cervical cancer?
One of the main signs that a lot of people actually don't have is if they notice bleeding after intercourse.
Okay.
So the thing about...
Now, is that common for some women? Could it just be this is how my body is made and this
It
is what
could
happens?
be.
Okay.
It could be a benign thing that happens, but it's
Okay.
not typical. So
okay.
it's definitely something that if you notice that, it's a reason to come into the office.
How many times, like if somebody is having sexual activity with their partner and they notice their blood once or twice or a few times, how many times should there be blood for them to go, hey, you know what, I need to really make an appointment and see my doctor?
Well, the thing about cervical cancer is that it takes a long time for it to develop.
Okay.
That's why it's so important to do pap smears,
Okay.
is because since it takes time, if you are coming to see us routinely as you should, then hopefully we capture it, like Dr. Nguyen was saying, in the dysplasia stage before it really turns to cancer. So most women that have cervical cancer tend to be the ones that didn't follow up routinely.
When you say routinely, doctor, how many times should a woman come in for a checkup?
So according to the ASCCP guidelines, women that are less than 29, they should start getting their pap smears at 21, and the pap smear should be done every 3 years.
Okay.
Once they're 30, then you would do pap smear and HPV at the same time. So that's called co-testing. And if both of those are negative, it can be stretched out to every 5 years. If they choose just to do the pap smear alone, that's every 3 years.
What about younger? Do
So,
you invite
yeah.
some patients to come in younger?
So the guideline says no matter when they became sexually active, to start it at 21.
So
Okay.
that is something different, and I think when we were younger, we grew up always hearing about annual pap smears, and I think that's really common for people to still kind of have that mentality.
Okay.
Because before, the guidelines did recommend pap smears younger than age 21, but I think it's from 2012 the guidelines
when they
changed.
changed it.
Yeah.
Now that being said,
Please.
the U.S. Preventative Task Force,
Okay.
October of this year, actually changed their recommendations, and they said that for women age 30 to 65 to no longer do co-testing.
Okay.
So it's either pap smears every 3 years or co-testing, or HPV testing alone every 5 years. That has not been adopted yet by ACOG, which is the American College of Obstetrician and Gynecologists. But again, I think that's a individual situation or individual conversation that you should have with your physician. And depending on the woman's age or risk factors or history of abnormal paps, I think that's when you can really determine if they should do the co-test or the pap smear alone or the HPV test alone.
So backing up a little bit, so if somebody after intercourse finds blood, and it's not common for that person, immediately come and see.
I think they should come in just for an evaluation, to do an exam, see if you know what's going on.
Because there are other causes of, so bleeding after intercourse, postcoital bleeding, can be caused by if they have some sort of infection where their cervix is just raw, they can have bleeding from that. If they have any sort of polyps, they can get bleeding after sex from that as well. So it's not necessarily cancer, but you should still come in so that we can rule out cancer.
So then, and just so I can pass this on to people that are watching, so other than a woman having her monthly cycle, to lose blood at any given moment after intercourse or anything.
Even just heavier periods or bleeding in between their periods.
Okay, so something that doesn't seem normal at all,
Correct.
make an appointment.
Yeah, and bleeding after menopause is never normal.
Okay.
So that is a different topic, but any menopausal woman that has bleeding should definitely come in for an evaluation.
So once again, bottom line, if something seems different at all, just
Yeah.
call your OBGYN. More with Dr. Pak and Dr. Nguyen when we come back. Don't go away. Joining us from Adventist Health Glendale are OBGYN super doctors, Dr. Marion Pak and Dr. Natalie Nguyen. Doctors, how does someone get cervical cancer? Let's go back into that.
There's several risk factors for cervical cancer. One of the main ones being exposure to HPV, which is actually the most common sexually transmitted virus. So there's several strains of HPV. Some cause or lead to warts, and some can lead to cervical cancer.
And HPV is called the human papillomavirus.
Yes, yeah. And something I wanted to mention, which I think a lot of women get confused about or just don't realize, because it is very awkward and uncomfortable when you go see your OBGYN and you have to do a pelvic exam. You feel very exposed. You can't actually see what they're doing because you have the drape over you. So a lot of people think that a pelvic exam is the same thing as a pap smear, and that's not.
Okay.
Because a pelvic exam can be for a lot of different things, and you're not necessarily doing a pap smear. So, and you find people even older in age are like, I need to come for my yearly pap, and they don't realize that the pap is for cervical cancer.
Okay.
So what I've been telling people is like, you do mammograms as a screening test for breast cancer, and pap smears are a screening test for cervical cancer.
Speaking of mammograms, we've done quite a few shows on Healthline about breast cancer and breast cancer awareness, and self-exams. You lay down, you check, you see if there's any lumps or anything that changes. Is there any self-exam or anything women can do to maybe check in the same guise of a breast exam cervically?
So I think if they are able to detect it, it would be pretty far in terms of it would be invasive cervical cancer. So you would want to catch it beforehand, just like how you do breast exams. You want to try to catch the cancer before it really develops.
Yeah, but like an
with
example with breast
cervical
cancer, you can feel a lump.
Yeah,
you can
and
feel so nothing like that.
No,
Okay.
not really.
And that's why it's important to do your screening cervical paps, because that's when you'll catch it early.
Yeah.
So there
But there's
are
no physical exam.
Okay, so there are no
No.
physical visual things that you can look for, check,
It's
see.
pretty difficult to.
Okay.
Yeah.
Yeah.
The conversation of HPV has become very prominent. It kind of feels like, okay, that came out of nowhere. Why do you feel that there's so much HPV?
Well, human papillomavirus is the virus that could be the precursor to cells that would then lead to cervical cancer. So HPV 16 and 18, for example, are responsible for about 90% of the cervical cancers. HPV 6 and 11 tend to cause genital warts. So there's a new vaccine, the Gardasil 9, which covers 9 of the HPV types that would cover 90% of or protect you against 90% of the cervical cancers. The older one, which is Gardasil, only covered for 4 strains, 6, 11, and 16 and 18.
But why do you think there's so much of it right now? Do you think it's environmental? Do you think people are living their life freer? Why? There's, like I said earlier, there's just so much of it that we're hearing more about it. Or do you think we're just more aware of our health?
I think the fact that the vaccination came out is also leading to a lot more awareness about it. And it's really important for, young kids to get this vaccination. It does not change, kind of sexual practices just because someone has received the vaccination. That often is a misconception.
Well, people think, it's so interesting, is people think, well, if I've got the vaccination or if I take this pill, I'm covered, and you're not.
No.
Yeah.
I mean, you're preventing something, and you're taking care of something, but it's not 100%
Yeah.
safeguard.
Well, because the vaccine doesn't cover all types of HPV, and not all HPV leads to cervical cancer either. But the CDC recommends giving the vaccines to children, boys and girls,
What age?
11 or 12.
Okay, both boys and
Yes.
girls,
And
same age.
depending on how old they are when they get their injection, it may be a 2-dose regimen or a 3-dose
So
regimen.
in a cycle.
Yeah, so this is like with your pediatrician, which
Okay.
I think for some parents is just kind of a strange foreign concept. But yeah, when kids are young, that's when they should be getting this vaccination.
Because you want to give it to them before they become sexually active. Because if they're sexually active and they already have one of the high-risk HPV strains and you give them the Gardasil vaccine, it won't protect them against that virus because they were already exposed. So the key is to try to get it to them before they become sexually active.
You said, before we wrap out, you said warts. If somebody gets HPV warts, can they be removed?
Yeah,
They can be removed.
absolutely.
Okay, but can they come back?
Yes.
They can come back, yes.
Okay, so once something's gone, it doesn't mean it's gone forever. It just
Correct.
means you have
Not
to
necessarily,
be
yeah.
preventative.
Yeah.
Okay.
Yeah.
More with Dr. Pak and Dr. Nguyen when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian, joined with two super docs from Adventist Health Glendale, Dr. Marian Pak and Dr. Natalie Nguyen. Doctors, we were talking about the HPV virus, and during the break we acknowledged that men can get HPV too.
Yeah,
Correct.
You were sharing some
So
things that we need to know.
how do we get the HPV how do we get HPV? You get it through intimate skin-to-skin contact. So whether it's vaginal intercourse, oral intercourse, or oral sex, or anal sex, those can all expose you to HPV.
But when you say skin to skin, it's not this.
Well, it has to be intimate.
Okay, intimate.
Yeah.
Okay.
And the other thing that
Please.
is very, very important is just because someone has already engaged in intercourse, you shouldn't think, well, I don't need to get the vaccination. You should still get it, even if it's up to age 26, so you can still receive it up to that age.
But after age 26, you can't?
Yeah, that's not the
Okay.
guideline. And if you happen to get pregnant and you didn't finish the series, you just take care of your pregnancy and then you complete the vaccination series after.
Can HPV be passed on to a child?
Well,
So-
for genital warts.
Yeah,
For
so
genital,
if,
okay.
if they have genital warts and they have a vaginal delivery, the baby can aspirate it and get
But usually
HPV.
that's with like very
Yeah,
extensive
extensive.
lesions. If you have maybe one small one, it's usually not a concern. And it's not an indication for a C-section either.
Is HPV or cervical cancer hereditary?
No, it's
Not at all. Not at
no.
all. Okay. You were sharing with us at one of the breaks some of the statistics.
Oh yeah, so 80 million people in the U.S. are infected with HPV, so that's 1 in 8 people in the U.S. currently have it. And in terms of new cases, it's 14 million new cases of HPV in the U.S. every year.
Doctors, why do you think there's so many new cases? Do you think we just don't talk? Do you think people...
Probably, and there's also no test for men either. So women usually find out when they get their pap smear.
Okay.
And there was one thing
Please.
that I did want to add is just because you got the Gardasil vaccine, it doesn't exempt you from the routine cervical screening. So you should still get your pap smears, even if you got your HPV vaccine.
Do me a favor, break it down again in regards to how old you need to be for your first checkup for a female.
I
with an
mean,
OBGYN.
any female can come see us at any point,
Okay.
even like a teenager. It doesn't necessarily mean we'll do a pelvic exam at that first visit, but it's just a good point to establish a relationship. For pap smears, you start at the age of 21.
Okay.
Regardless of when they first became sexually
Sexually
active.
active, okay.
And even though the guidelines have now spaced out pap smears to every 3 to 5 years, depending on how the test is done, it's still recommended to do an annual exam.
In regards to any signs or symptoms of HPV, anything a female needs to look for pay attention to? Because I know we addressed
Yeah, I mean,
the
I think
bleeding
that's
and
the
cervical
thing.
cancer.
That is, tends to be more of a atypical symptom, or when you really have symptoms from cervical cancer, that tends to be more of a late stage situation. But that's why the Pap smear has really changed, rates of cervical cancer, because it's been such an effective screening test. Because a lot of times you don't know that anything is wrong, so that's why we really need people to come in routinely.
In regards to women and just hygiene, can that participate with this as well? Contribute to it as well?
Hygiene, not really, but
No.
what matters is smoking. So tobacco use is a risk factor.
Okay. Anything else?
So we talked about the high risk, or
Yeah.
what puts you at higher risk
What does put
of
us at-
cervical
put women at
cancer.
high-
So smoking, because it interferes with healing. Anyone
Okay.
who's immunocompromised, people who have HIV, that also puts you at a higher risk, because if your immune system is weak, you're not as good as clearing the HPV on its own. Because usually someone who has HPV, a young woman with a healthy immune system, can clear it between 6 to 24 months. So they won't even know that they had it sometimes.
And that's part of the reason why the age of initiating Pap smears at 21, that's where that changed, why that changed.
So then, doctors, can someone die from HPV?
No.
Not directly
Okay.
from HPV, but HPV can lead to cervical cancer,
Okay.
and people can die from cervical cancer.
Final thoughts on women and health, Dr. Pak?
I think the most important thing as a woman is to be open and comfortable with your physician, and really have established that kind of relationship where you can talk to them freely, openly discuss any concerns, because at the end of the day, it's your body, it's your future, and we are here as a resource to help women.
Dr. Nguyen?
I think it's very important to partner up with your patient. Something that may work for one patient may not work for another person. So I think you really just need to listen to them. Most of the time you can get the diagnosis just by talking to them and not ordering any tests.
And both of you are new to Glendale. Where can people find you, Dr. Pak?
So I'm actually working in an office that's very close to the hospital. It's on Chevy Chase, and I work with Dr. June Choi, who's also worked in this community for over 20 years.
Great.
Yeah.
Dr. Nguyen?
I am working in the Physicians Medical Terrace, which is on campus with Glendale Adventist.
Well, it's great to have you as part of the Healthline family. Thank you so much. Okay, so you heard it, and here's the most important thing I heard. Talk about it. Talk about it to your girls. Talk about it to your mom. Talk about it to your partner. Talk about everything, because the most important conversation you're going to have is about you and your health. So why not say, hey, this is what's going on. Hey, this is what's not going on, and just be open about it. For more information on everything Healthline, please visit us at YouTube on AHGL Healthline. Follow us on Facebook at AH Glendale, Twitter at AH Glendale, and find us on LinkedIn, Adventist Health Glendale. And I'm at Gregory Zarian. We'll see you next time. Have a great week. Thanks.